Hi, I'm Mitch Berzon, a personal injury and medical malpractice attorney practicing here in Long Island. Today we're going to talk about the concept of hospital-acquired infections. We go to hospitals to get better. But did you know that for many people, the hospital ends up being one of the most dangerous places they've ever visited? I'd like to take a few minutes to talk with you about hospital-acquired infections, how they can be prevented, and how to protect your rights if you or a loved one is hurt by an infection they picked up in a healthcare setting. Hospital infections, including MRSA, cases of sepsis, and other life-threatening bacterial infections, are more common than most people realize. They cause a great deal of pain, loss of tissue, loss of limbs, loss of organs, and sometimes can result in a patient's premature death. Even with mild cases of MRSA and other entrenched infections, recovery can be a long, costly, and painful process. The worst part about most hospital-acquired infections is that they can be avoided if proper sanitation procedures are followed by the hospital and medical professionals working there. Infections don't come out of nowhere. They get transferred from an infected person to doorknobs, other surfaces, to medical tools, and to the hands and bodies of medical professionals. And if these surfaces, tools, and hands aren't sanitized quickly and properly and completely, then other at-risk patients can become infected. Anyone with a weakened immune system or with an open wound is at especially heightened risk for acquiring an infection in a hospital. Elderly patients, people taking medications that suppress their immune system, people suffering from injuries that broke the skin, and patients with surgical incisions are common victims of hospital-acquired infections. Special standards of care are required by law in New York State when treating such patients to ensure that they are not infected with virulent and life-threatening bacteria. If these standards of care are not met, and you or a loved one does end up infected with MRSA or another bacteria picked up in the hospital, New York law says you are entitled to compensation for medical costs, lost wages, and pain and suffering. It isn't always possible to make sure hospitals and staff are taking the necessary steps to prevent the spread of infections. But it is definitely possible and advisable to hold those institutions and professionals accountable for the negligence. Contact an attorney with experience handling cases of hospital-acquired infections. You can call our office at 631-265-6300. Visit our website at bsb-lawyers.com to read more valuable information regarding those infections and your rights under New York law. Whatever the details of your case, and however uncertain you are about your right to collect compensation from the hospital, give us a call for a free consultation. We help people like you every day. It's why we're here. Again, I'm Mitch Berzon. Thank you for listening.